If you're joining us for the first time, maybe you're wondering what SIHI is and what SIHI Talks is all about. We are the Social Innovation in Health Initiative, SIHI for short, pronounced as SIHI, which means upward and forward looking. SIHI is a global network of passionate individuals and institutions who dream of a healthier and more equitable world through social innovation. Since 2014, we have been advancing social innovation in health through research, capacity building, and advocacy. We currently have 13 country research hubs in Africa, Asia, Latin America, and the Caribbean, and Europe. SIHI Talks is a series of monthly webinars that we hold to provide a platform for potential and current partners to connect and find opportunities to collaborate. Welcome! We're glad that you could join another conversation on social innovation today.
So, welcome everyone. Thank you for joining us here on Zoom, as well as those who are watching through Facebook and YouTube. Perhaps some of you are watching through Facebook and YouTube right now. My name is Agi from SIHI Indonesia at Universitas Gadjah Mada, and I will be moderating the SIHI Talks. Today's session builds on the TDR MOOC on community engagement, social innovation, and implementation research for health impact. I know most of you here perhaps have completed the course. And so thank you and congratulations on completing the course. If you haven't received your certificate, please check your dashboard. You should find the certificate there, along with our newest feature to share certificate to LinkedIn. So before we begin the sessions tonight, just a few house rules to keep things simple. Please keep your cameras and microphones off unless called on, but feel free to use the chat box to introduce yourself and share comments throughout the session. The sessions is being recorded and live streamed through YouTube, so you can revisit at any time. Just simply look up SIHI Talks and find the session over there. So let's begin. So today, first, may I call on Dr. Beatrice Halpap, the co-founder of SIHI, for an opening message. Dr. Beatrice?
Thank you. Thank you so much, Aggie. So welcome to everyone. And on the behalf of TDR, it's a pleasure to have you in this event. And we'd like to thank for this invitation and for organizing this SIHI talk, the SIHI Secretariat, the SIHI Indonesia, and TDR Global Asia. And it's a wonderful way of synergy and collaboration amongst institutions. So a pleasure to be here and a pleasure to hear what you will have to share with us about the MOOC on social innovation and community engagement. Just a few words about social innovation in health, which are really key and critical in order to address the healthcare delivery gap in low and middle income countries. And they are really a new lens, a new way, a new approach to look at issues, identify the issues, and develop the solutions. They are a bottom-up approach, community engagement, and also co-creation of solutions together with the various stakeholders, including innovator communities, but also the government and researchers and any stakeholder that are critical and engage, and all to work towards an inclusive and affordable solution. So social innovation are really about, broadening the scope of innovation. We often look at innovation as technologies, but technologies on their own are not reaching the people they are supposed to reach. So they really need this social aspect, and altogether that makes a bit of the magic. And for those innovations to be sustainable, there is a need to understand what works, what doesn't work, and to conduct research in order to have real evidence that is credible and that can help also to sustain the activities, to be effective, but also to scale up and engage new partners. So this is why TDR in 2014, together with other university, engage in establishing SIHI, the social and health initiatives, in order to promote the value of social innovation, as well as enhance the capacity of social innovators and embed research and embed social innovation within the networks. So this MOOC models on social innovation and community engagement are quite well nested into the TDR implementation research MOOC, as you can take them on your own, standalone, or as part of the IR implementation research MOOC. And you don't need to be a researcher, you can be an innovator, or you can be a researcher. You'll see both of the aspects. So we are very pleased to have SIHI Indonesia taking the lead in order to conduct the MOOC, facilitate it, pilot it, and we'll hear today quite nice stories about it and about the innovators in both of the countries, Philippines and Indonesia. So thank you so much, and we're looking forward to hearing about all this. Over to you, Aggie.
Thank you very much, Beatrice. Always a pleasure to have you join us. Well, what Beatrice said is very interesting, that social innovation is one solution to help solve the health gap in the field. Perhaps some of you researchers have known that we need to broaden the scope of the innovation also to help the community to thrive and perhaps finding a better solution, a better tailored solution for all. That's really amazing. And perhaps some of you here has already tried the social innovation in your field. We know that community engagement is practiced in different ways around the world, and the MOOC, past MOOC, showed us several case studies on how it can be applied as part of social innovation and implementation research. I know some of you here from Asia perhaps think that this is very new. So we will find some context in social innovation, especially in Southeast Asia. We will have two short presentations to share with you about social innovation, focus on the Southeast Asian context. First is from Dr. Meredith Del Pilar Labarda, lead of SIHI Philippines, and the SIHI Secretariat. She is a social scientist, medical doctor, and a professor at the University of the Philippines, Manila School of Health Science. And the second is from Malida Magista, the hub manager of SIHI Indonesia. She is a health communication specialist dedicated to advancing public health through innovative solutions. So let's get started. First of all, Dr. Meredith, thank you very much for joining us. The floor is yours.
Thank you, Aggie. It's a pleasure to be here. And of course, it's a pleasure to partner with SIHI Indonesia in doing this session of SIHI Talks for this month. Let me just share my slides. All right. So I hope you can see it in your screens. All right. So again, good day to everyone. And of course, I bring warm greetings from the Philippines and from the Social Innovation in Health Initiative, or SIHI Global Network. And of course, the SIHI Secretariat, which is based in the Philippines. I'm excited to share a little bit of what the network does, who we are, what we do, of course, including the things that the different hubs and partners are doing in different parts of the world, especially for this specific context on community engagement, which is at the heart of every social innovation. As Aggie said, this is a special session because we'll be focusing on how we do community engagement in the Southeast Asian context, and of course in similarly situated communities. And probably later on, when we do the open discussion, we'll see how similar or how different do we do community engagement, because this is very important when we talk about, and of course, when we implement social innovations in health. So just a short rationale of social innovations. I know Beatrice has concisely already walked us through what social innovations is all about and how the network started. But I think for most of us, or all of us who have partners in communities and who are doing community work, we know that this findings in the study is still very true even up to now, that there is still a healthcare delivery gap, and half of the world lacks access to essential health services. So I think we see this every day, especially in countries like Indonesia and the Philippines. So if you look at our website, there's when in the early years of SIHI, there's publication about what if communities hold the solution for universal health coverage. And this is by Dr. Jan Reeder, of course, the director of TDR, together with other colleagues. So it's very interesting because it posed the question, what if people were given the opportunity to address their own health problems with locally generated solutions? And what if these solutions were sustainable and indeed scalable? And what if improving healthcare also empowered people, providing economic benefit, and even provided hope? Surely this is a worthwhile topic for research. And in the last 10 years that the network has been going on, this has been the interesting questions that we have anchored most of our work and our researches on. So these are demonstrated in the different thematic series of social innovations that are, if you're interested to look into our website, these are featured. And we hope really to contribute to the transformation of healthcare delivery. So if there is a healthcare delivery gap, there is, in fact, the opportunity for social innovations. So as Beatrice mentioned, we define in the network social innovations in health as inclusive solutions that meet the needs of end users through a multi-stakeholder community engaged process. So we know that the output and the impact are important, but equally important is the process, how we get there. So that's actually the community engaged process. So in the network, as mentioned, we're more than 10 years already, actually, as a global network, and we are really invested in advancing social innovations in health. So our vision as a network is an inclusive and equitable health that's empowered by social innovations that unite communities, health system actors, other stakeholders, ensuring that no one is left behind. And our mission as a network is to accelerate universal health coverage and health equity through research, capacity strengthening, and advocacy for social innovation, again, anchored on community engagement and social justice, especially in low and middle income countries. So as mentioned, the network has been growing vastly. So in fact, during the pandemic, that was, I think, the most accelerated expansion of the network. We are now moving towards 14 hubs and beyond. So we're positioned in different parts of the continents and in different parts of the world. That's why we are excited today for the discussion and community engagement. This would come from different contexts. There may be diversities and innovations in how this is implemented. So this is an important co-learning platform. All right, so our theory of change in the network, as shown in the screen, shows that on the left side, the SIHI hubs are the key movers in the network. And I'd like to zero in on one of the focus areas of the hubs, and that is championing community engaged social innovations using SIHI approaches. That, of course, we have 4 major ones, but on top of it is an approach that supports bottom-up solutions to global and national health security challenges. Of course, we want to contribute to the universal health coverage and the attainment of the Sustainable Development Goals. So I'll zero in on that, and in my next slide will focus on how we understand it and how we implement it and how we do it in social innovations. But towards the end, I'll be showing some concrete examples of social innovations that have shown very tangible community engagement process and how it was done in the context of Asia. All right, you can see this work in our website. And by the way, we have newly launched our website. So if you want to go to the different resources of the network, you can find it there. And there is one interesting study in the early years of SIHI that was done by Dr. Lindy. That's the application of social innovation in healthcare. And of course, she was together with a lot of SIHI colleagues who are still championing social innovations in the network, the paper on the application of social innovations in healthcare. And as you can see, this is a product of a scoping review. And as you can see, social innovations usually begins with a challenge, which is the stimulus to a social innovation. So this challenge is experienced within a certain context. So this may be different in Africa or different in Asia or even different in other parts of the world. But this is influenced by intersecting social determinants or factors. And these challenges that are addressed by social innovations are usually the difficult challenges, or what we call wicked problems, or the grand challenges, which are complex and systemic in nature, meaning to say it's not a simple linear problem that can be solved by one solution. So the next component is the participation. So we see here how communities and stakeholders engage. And as Beatrice mentioned earlier, this actually makes social innovations different from a purely technological innovation. There is a participatory process that usually promotes social inclusion, and the popular mechanism of co-creation, co-production, and co-design are often seen here. So we see different actor groups that are involved. They may be, at the start, they may be just an individual or a group of individuals. They may be social movements, organizations, whether they're in government or non-government, or even a hybrid of organizations, or even a cross-sectoral or cross-boundary relationships that are fostered in this community engagement. And then there are creative solutions that are, this is now how social innovations are formed, which again may be in different forms. So there may be, in most cases, entirely new, but more often also it can be a combination of existing ideas or products, which actually gives a tangible solution, a relevant solution to this challenge. And because of these processes that are involved in coming up with the solution, the next stage is actually empowerment. So social innovations increases participation levels and empowerment, enabling greater access to resources, and increases social and even political capacity. So there is redistribution of power or change in power dynamics. And in the later examples, this is very evident. So there are new collective capabilities that are achieved. So in the long run, of course, this does not happen overnight, but this results in change at an institutional or systems level, and we can see a societal impact. So that's really the long-term vision of social innovation. So there are changes in internalized solution, meaning mindsets of people who are involved, and even in externalized solutions, meaning changes in structures and systems. And there is a potential for the social innovations to address really the root causes of health challenges. So if you want to read more about this, we have shared this in the website, so you can check our website, www.socialinnovationsinhealth.org. So let me just share briefly some examples from different SIHI hubs in Asia and some of their standout social innovations. So one is from our colleagues, our partners in SIHI China. So the social innovation Pay It Forward. This is a community-driven strategy used in health research to increase access to preventive services that usually require payment, just like STD testing. So this social innovation works by offering individuals a free service funded by previous participants and inviting them to donate or leave supportive messages for others. So building a cycle of generosity. So its unique approach to community engagement includes using crowdsourcing to develop the program, its strong community ownership, significantly increasing participation rates among marginalized groups like sexual minorities in China. Another social innovation from India, which is part of the earlier years of social innovations that were scouted through crowdsourcing, is Nura Health, which addresses the shortage of trained medical professionals in India by empowering patient families in the communities to become key partners in post-hospital recovery through skills-based training. So it works by developing or strengthening capacity using a train-the-trainer model, where hospital staff are equipped to teach families practical caregiving skills, leading to better patient outcomes, fewer readmissions, and even higher patient satisfaction. So their unique human-centered approach engages families as an untapped resource, tailoring programs with continuous input from caregivers and healthcare providers to meet diverse needs across different settings in India. So we see here the partnership between the healthcare system and families in the communities. Of course, this will be shared later on by Malida, so I'll not discuss this in great details, but just to say that in SIHI Indonesia, there's a social innovation also called Harapan Tian, which is in Yogyakarta, Indonesia, which assists mothers and children in the streets to gain access to health, social, and educational services. So I'll end with an example from the Philippines, which we call the Community Engagement Self-Monitoring, or the CESM strategy for social innovation in health. There are 2 publications that we have shared already in the website, so you can also read in details there, because I'll be sharing this very concisely. So community engagement in social innovations refers to active engagement of a community with other partners to modify existing practices or introduce new methods, to eliminate challenges, and of course, we want to improve the individual and collective welfare of the community. So if we define these 2 concepts, self-monitoring is a process by which a community is empowered to monitor and oversee the performance of a project to ensure that its intended objectives are achieved. And for the community engagement self-monitoring strategy, it incorporates the 2 approaches to allow communities to be further involved in health programs and activities, and of course in also engaging communities to identify gaps to fill and how best to do this. Okay, so this strategy allows health services to become more responsive to the needs of the community, and even making it more accessible to all. So this study was done by Social Innovations in Health Initiative Philippines in partnership with our social innovators. So we revisited 2 of our social innovations in the country. In the first round, when we piloted this, there were 2 social innovations involved. And then we had some findings, but we wanted to analyze deeper the concepts and the processes. In the second round, we focused on a single social innovation, which was an island rural setting. So what did we find in this study? So, right. So the important findings that we had in incorporating the CESM, it has demonstrated the pivotal role of community engagement and leadership. These 2, they play in motivating and empowering communities to actively participate in social innovations. So with our engagement with the social innovations, it has demonstrated that, in fact, integrating praxis sessions and capacity building activities in the strategy, because we worked with a lot of volunteers from the community. So once we integrate this capacity strengthening and praxis sessions, it provided a safe space for grounded reflections and learning exchange that ensure relevance and sustainability of the CESM strategy. In fact, at the end of the study, when we recommended this as a policy to the municipality, they actually adopted this as a municipal ordinance, not just as a strategy to monitor social innovations in health, but it has also been used in their tourism and education. So it has been used by the community. So proactive leadership and political commitment are important aspects of this strategy, which has significantly influenced the performance of the communities. And communities were shown to be capable of implementing their own projects and programs aimed at improving their own well-being. So in a gist, we found that when social innovations are conceptualized, co-created, and used by a community, there is a sense of ownership and a better grasp of their principles, making the implementation and even the monitoring process more efficient and meaningful at the community level. So on the right, you see the process, and the colored ones are the ones that we injected, so to speak, in the original CEM strategy that we had in phase 1. All right, so to close this, I'll end with the ways forward of the network. So building on all this decade of achievements, the network still commits to prioritize. Of course, number 1 on the list is community engagement, resilience, and social justice. And our focus still includes areas for impact. We want to contribute it to local and global health security, and of course, in collaborating for sustainability and impact. So this is my last slide. So that's in a nutshell, community engagement in the 2 aspects, the global SIHI network and in the SIHI social Southeast Asian context. So I hope this would be an interesting interaction. So thank you very much for the opportunity, and back to you, Aggie.
Thank you so much, Dr. Meredith. That is such an enlightening introduction. I think that's great what SIHI already do in Southeast Asia, even though the concept is relatively new. So we move on to the next session. Malida Magista, the Hub Manager of SIHI Indonesia. Hi, Malida. The floor is yours.
Thank you so much, Aggie. So, wait a sec. I'll share my screen first. Okay, I think that I need to reset. Perfect. So, greeting everyone. Thank you so much for the opportunity. And I think that I can skip this slide, and let me introduce myself first. Good evening. I'm Malida, and I'm the representative of SIHI Indonesia. So I want to begin by thanking all of you that joining us at the SIHI talk. We are so excited to meet all of you wherever you are right now. So basically, the MOOC is already highlighted by Meredith and all Dr. Meredith and also Dr. Beatrice. So I think it is really interesting to highlight about like who is the participant of our MOOC, and we already got the result, and it's really interesting that so basically there's a 1,500 participants that coming from various countries across Asia, Africa, and Latin America that participate in the MOOC, and also the highest number of participants from Africa and Asia, particularly Nigeria and Ghana in Africa, and India and Indonesia in Asia. So thank you so much for the participation. And if you look at like who is like the one who participate in the MOOC, so there's like is leading by the public health officer and researcher. So it's like mainly from the public health sectors, and followed by the healthcare provider and practitioners. And the interesting part is like the majority were like master degree, and also followed by the bachelor degree and PhD as a big higher educational qualification. And I think that's all for the introduction for the MOOC. And I think right now, let's begin to the topic itself. So the one that we want to highlight is social innovation for the marginalized population and how research collaboration is supporting their work. So the first part is like about, like, let me introduce SIHI Indonesia first. So SIHI Indonesia was started in 2020 at the Center for Tropical Medicine, Universitas Gadjah Mada. We have been dedicated ourselves in documenting, identifying, and also disseminating and strengthening social innovation across the country. So we conduct like crowdsourcing initiative, case studies, collaboration, and also other impactful efforts for social innovation in Indonesia. We'll get in depth for that later. Oops. Okay. So about like how we identifying social innovation in Indonesia, we conducted that crowdsourcing in 2021, and this is how we made Harapan Fian too. So we conduct like a social innovation in health crowdsourcing, focusing on health emergency responses, infectious disease control, and also primary healthcare prevention. There were 38 applications, and we selected 9 promising innovation, and later there's a kind of like workshop mentoring on documenting and disseminating the work. And afterward, we highlighted 3 top innovation based on the review process, and one of them is Harapan Fian. And the second one, we are working on the documenting the works of Harapan Fian within like, I think for the past 3 years, it's quite long. There's several studies. The first one is like learning about the Posyandu Jalanan program. We writing on case study of Posyandu Jalanan. And also we are also having like intersectional gender research, and it is focusing on intersectional challenge and discrimination affecting women in sexual and reproductive health in marginalized setting, and is focusing on Harapan Fian community. And the last one, the one that we are running right now, is focusing like embedding in implementation research, and it is focusing on enhancing the health promotion and early detection capabilities of community-based health program in strengthening resilience of marginalized communities in infectious diseases. So the main topic is about like strengthen the resilience of marginalized communities facing infectious disease, and is focusing on Harapan Fian program, Posyandu Jalanan. Next, and it is like so not Harapan Fian. So SIHI Indonesia is not only focused on documenting and research. We also focus on like popular dissemination, and so that we produced together with the social innovation that selected the three appreciated the top social innovation. So the Sekolah Sekoci and also Harapan Fian and Keran Air Telaga. And also, so beside the short documentaries, we have like a social media contents to further amplify that impact. So, and you also can watch their short documentaries through the YouTube channel of Social SIHI. And next, it's necessary. The second part, let me introduce about Harapan Fian and its innovative program, Posyandu Jalanan. So, we have like a short documentaries about Harapan Fian, and I think it's really interesting for all of you kind of like learn more about Harapan Fian from the initiator itself. So let me play I hope video is okay. Is there any like, can you hear that audio?
Malida, I think there's no sound in the video. Maybe needs to be there.
There's no audio.
Yeah, perhaps you can reshare the
Okay, sorry.
presentation.
And yeah, I think, wait,
I
sorry
think you
for the
can
trouble.
play it again because there was sound already before it was paused.
All right then. Wait a second. Error in my part. So I hope like the subtitle will help all of you, and later you can kind of like watch it through the YouTube of like a SIHI. But I apologize for the technical error, but then let me continue the videos and I'll explain like later about like this topic.
Yang utama ya, itu ada pendampingan identitas. Kegiatannya cukup fleksibel ya, karena tergantung kasus seperti apa. Nah, entah itu kita ada pendampingan ke Dukcapil, ada pendampingan ke polisi misalkan, tapi juga kita ada kegiatan untuk menyasar kebijakan publik. Lalu juga yang tidak kalah penting adalah di isu kesehatan. Jadi kita mendampingi teman-teman di isu kesehatan reproduksi, tetapi juga kesehatan umum. Nama Posyandu kita pilih karena itu familiar ya di telinga masyarakat. Jadi Posyandu itu ada beberapa kegiatan. Yang pertama adalah pemeriksaan kesehatan setiap sebulan sekali. Nah, di pemeriksaan kesehatan itu ada pengukuran dan pencatatan pertumbuh kembang anak atau juga ada monitoring ibu hamil. Kegiatan yang lain di dalam Posyandu adalah pendampingan teman-teman ke layanan kesehatan publik, yaitu Puskesmas. Jadi karena mereka ada hambatan, jadi kita perlu ada pendampingan ke sana supaya mereka dapat layanan kesehatan. Jadi mereka ketika ingin memeriksakan kesehatannya, anaknya itu datang ke sekretariat kami. Lalu ada juga kita melakukan pendampingan ke komunitas. Kita mengadakan posyandu di lapak pemulung. Selain itu juga kadang ketika kita dalam pemeriksaan kesehatan kita menemukan ada kasus yang butuh apa istilahnya pendekatan intensif, kita melakukan house visit. Jadi kita datang ke rumah-rumah.
So, apologize for cutting like the video in the middle of it because like, it's quite long, and I think as I mentioned that you can watch at the YouTube channel that is already available, and also maybe I would like to kind of like highlight like the issues that underlying the Harapan Via and Posyandu Jalanan, why it is like occurred. So, so Didin, or like we call it like Mas Didin, is like the founder or like the initiator of Harapan Vian. They are named like people, the beneficiaries, like people living on the street, not like homeless or something, because some of them already have house, but they are living off from the street. So they have like terminology, like people living on the street, and we feel like these communities is kind of tend to be forgotten. So if you see like this data, so this is a data of unmet health needs in Indonesia, in Yogyakarta. And it's really interesting that it's really low, like under 5%. But it's kind of like throughout our kind of like studies in the past few years, it feels like this data actually is not really reflect on the severity of people that cannot access the healthcare, despite of the right now Indonesia have like a universal healthcare, or maybe Indonesian people know it's like a BPJS. And also, and then why it's already there's a universal healthcare service, but then why they cannot access it? Because those community actually have like a challenges in accessing free healthcare. That's because of discrimination. And discrimination is not only in the grassroots level, even in the regulation or policy level. And also there's a patriarchal culture where the male needs to dominate the woman, and also limited access to health awareness and knowledge. So it seems like a Posyandu Jalanan try to answer this challenge, and they're trying to bridge the gap of a healthcare. But not only that, they also focus on having a safe place for marginalized community, especially women and children. As you know that in the video, like the Posyandu Jalanan is dominantly the beneficiaries are children and women. So as Harapan Fian is focusing on women and children that living on the street, and there's a question why they are the most vulnerable population. As our study is still going on, we found that there's a multifaceted burden that facing by the woman and living on the street, because they also need to balance the domestic responsibility and meeting the family financial needs. While the man is the one who responsible for the finance, but usually some of them actually the woman is also looking for the money, and also at the same time they need to be responsible for the children and domestic responsibilities. So imagine if they are sick, who will taking care of them? And then also there's a gender-based power inequality. So health and wellness of women in living on the street are influenced by systemic gender-based disparities. As we mentioned about like male dominance in the family. So if you mention about like why they keep on like we're not using contraceptive, that's because like if the woman would like to kind of like managing or like controlling their pregnancy, if the male doesn't allow that, they don't have like have a good bargaining power on that. So usually the man will kind of like decide. The husband, or like even like the healthcare service, they also ask whether like have you have like kind of like permission from your husband about like having contraceptive. And also not only male dominance, but also there's a verbal, physical, and economic and sexual abuse. So it's not only like a physical. The one that the most ironic one is like Harapan Fian is also only kind of like helping the woman that having a physical and sexual abuse. Beside that, for example, like verbal, economic is already happening, but there's kind of like it considered normal. So it's there's nothing much compared to physical. So if there's a physical abuse, like Harapan Fian is usually like assisting them. And also like there's a woman and children exploitation. Our participant, or like the one that we interviewed, actually like a victim of like a children exploitation, or actually they are a woman like that still working on the street despite of being pregnant or something. So women and children is easily exploited, especially in looking for like for fulfilling the financial needs. And also marginalization is also coming from the healthcare, not only from like the family or the grassroots level, but also from the policy level. Interestingly, like the main problem of like those people, as mentioned as Masdidin in the video, that the ID ownership. So most of them, not most of them, I think like many of them actually doesn't have ID. So it's you maybe you kind of like questioning why they don't have like ID. Not only not having the card, but they are not, then their name as an individual is not registered in like public services. So this is quite challenging because like if we mention about like universal healthcare and also like a school and everything is based on ID. So they cannot access the public service because of that. So later there's like if you're mentioning about the contraceptive in Indonesia, if you are not legally registered for your marriage, it means like you are not married yet, and the healthcare is regulated to not give contraceptive to women that not married yet. So it's kind of tricky. You cannot register your marriage because you don't have ID. But then because like you not register your marriage, you cannot receive contraceptive. And also then later your children cannot have like kind of a good public services. So there's a plenty of discrimination that happening, but we won't get in depth on that. So that's why Harapan Fian is coming in 2018. This consists of staff and volunteers including doctor and midwife. And basically, if you're from Indonesia, you're already familiar with Posyandu. Posyandu is community-based antenatal care, and it's for individuals that can do doing antenatal and postnatal care. The most interesting part of like Posyandu Jalanan is not only for the antenatal and postnatal care, but also community health checkup. So there's a doctor that kind of like volunteer to like having a health checkup and also going to home visit for people that disabilities. So if you got a stroke or something that you cannot go out from your house, the doctor will come to you. And also there's a community assistance. So if Harapan Fian found like there is issue throughout from the Posyandu Jalanan, they will kind of like having a follow-up assistant from like home visit to like assisting them to have like a ID or like the health insurance. And it's funded by the crowdfunding. If you see that there's like a number of beneficiaries in 2021 up to 2024, 24, yes. And if you see that throughout this year, in a year, their beneficiaries is under 100. Well, there's several reasons for that. It seems like why it is so small, is there less impact and everything, but actually because like the first one is for Harapan Fian can assist one beneficiaries throughout the months or maybe years. So for example, the second beneficiaries that been assisting from being like a teenager on the street and like no, she is a mother of two. So like this assistant is kind of like really human-centered assistance. And also the second one is like there's a implementation gap in Harapan Fian where like they don't have like a good documentation of medical record, and it seems like that's why there's an underrepresented number of like the impact that they have been doing throughout the years. But this is interesting part. It is a Posyandu, but they already handled not only contraceptive, and antenatal care, but also unplanned pregnancies, malnutrition, contraceptive issues, identity-related issues, domestic violence, health-related issues, even like they assisting people with tuberculosis and leprosy. So it's really interesting, the diversity. Most of them is like kind of like identity. So they are assisting people to have ID and health insurance. So the last one about like how Harapan Fian and also SIHI Indonesia kind of like collaborate to kind of like strengthening their works program with implementation research. As you know, that people who going through the MOOC, there's a kind of embedding implementation research to social innovation. So SIHI Indonesia believe that implementation research is not only for evaluating program, but also like kind of like offering a comprehensive and practical solution from the identified gaps. So SIHI Indonesia have been like doing assessment, collecting data in Harapan Fian for the past few years, and we identify key implementation gaps, and we will kind of like describe it later. And throughout the process, we agree that we kind of like trying to solve those problems. And we receive a grant from TDR to conduct a collaborative research, and we are going on, it is going on right now. So what is implementation gap identified? The first one is kind of like they have like kind of for the infectious disease, we're learning from like a pandemic that there's an insufficient precautionary of measure. They don't have like kind of like protection for themselves. If there's like a cases of tuberculosis, leprosy, they don't know because like most of the staff is having no medical background. And also they don't have the high turnover of volunteer and staff. It's quite challenging because they keep on working on vulnerable communities. So it's mean like there's a critical needs of a well-structured knowledge transfer system. They don't have it right now. And also third one was kind of like they don't have like a really early detection system for infectious disease. For example, if there's like a symptom of tuberculosis of one of the beneficiaries, they're not really sure that what is this disease, whether it is infectious or not, and what should they do. And also, the most important is like the referral system gap. They need to be advocacy for like a referral system to the healthcare system, and also need of government recognition. And also, as I mentioned before, that they don't have any medical record, like a systemized medical record, and we are trying to work on it right now because we feel like it's really important for the advocacy needs. And so there's a research, I will be like a quick about that, and is focusing on we trying to kind of answer this gap, and also intervention is modifying the posyandu jalanan with strengthening the precautionary measures, and also doing a training program for staff and volunteers, and later establish a posyandu jalanan handbook for like a knowledge transfer among the staff, and also the last one, the most important, government involvement and advocacy. We are working on like communicating with the social department and also health department in our cities. And the study design is kind of like with one group post-test precise quasi experiment design. It is happening in 2 locations. We are involving staff, volunteers, beneficiaries. The most important thing of this research is it is a collaborative research. So we actively involving Harapan Vian and also their collaborator. It's like PU, the midwife volunteer group, and also the Mercy, the doctor volunteer group. So basically, it's quite quick, but it is still ongoing. We'll keep update you about like the result of our research. And I think that's all from us. Happy to have a good question from all of you or discussion. Thank you.
Well, thank you so much, Marida and Dr. Meredith. At this point, we'd love to hear from you as well, our audience today. We're extending the session a bit to understand and reflect on your experience too. So we prepared some questions about your reflections on the MOC and experience with your communities also. Those who wish to stay and hear more about it, please stay because we're going to have a session for this experience. To facilitate this, please visit our Mentimeter through the QR code on the screen or through the link on the chat box. Julia from SIHI already shared the link on the chat box, or you can just simply scan the QR codes with your phone camera, or click on the menti.com and use the code 25724958. If this is too difficult for you to access, you can also share your answers on the chat, and I will read some of it. So is there anyone facing difficulties on joining the Menti? Or we can go for our first questions. Where in the world are you joining us from? We see 12 response already. From Assam, India, Honduras, Malaysia, Nigeria, Kenya, Egypt, Japan, Ghana, Philippines, Burkina Faso, South Africa, Kenya, Sri Lanka, Ethiopia, Washington DC, USA, Japan. Oh, we have you all around the world. I've seen all the continents, Mali and Tanzania. Oh, there's plenty of you. There's also from Brazil, sharing on the chat. Colombia, Russia, Trinidad and Tobago, Yemen. That's really cool. Perhaps there's 2 people on the audience. You want to share or give an example of a community engagement activity that really made impact on your country? We have Ivory Coast, Somalia, and Chad, Togo, Ghana, joining us from all around the world. That's really great, I think. Is there anyone here wants to give an example of the community engagement activity that really made an impact on your country? Someone wants to share your story? I see Luis Gabriel Cuervo. I just wanted to say that it's great to learn about this example of homeless people involved in innovations to improve their healthcare. Municipal authorities in Jaboatão de Guararapes in Brazil have a fascinating social innovation on similar topics, and we could explore ideas exchange. Luis Gabriel Cuervo, perhaps you want to share a bit with us today about this example in Brazil?
Yes, thank you very much. Yes, well, I am with the SIHI in Latin America, and a couple of years ago we had a presentation here from an innovators in Jabotão de Guararapes. It's their work, not mine. But basically, they had problems of accessibility to vaccination and to health services in this city in Brazil. And the mayor's office, led by Paula Correa Lima, they organized an initiative basically bringing the services, getting to work together with homeless people to identify what were the barriers and then addressing them. And for example, they brought vaccination rates from 32%, I think it was, to 88%. They had a huge impact, but then they looked at other things, dental care, education, and so on. So it's had it has evolved in a fascinating way, bringing improvements to the quality of life of people and also to the whole community. And I think I was listening to this beautiful example and thinking we should get them together, because there's a lot of perhaps opportunities here for exchange. And that's what I wanted to share when I put that example there.
Yeah, thank you so much.
The reference and the recordings are included in the link.
Yeah, thank you so much, Mr. Luis Gabriel Cuervo, for sharing the beautiful experience from your SIHI Latin America. So, Malida and Dr. Meredith, how about you? Have you experienced using this kind of activities? What do you think about sharing these initiatives of social innovations?
Yeah, I think let me also react to Luis Gabriel. I think, yeah, the collaboration and the partnership, the learning together is very important. So of course, Brazil may have a different cultural context from also what Indonesia and the Philippines are doing. But I think with our work with community engagement, there are what they say, universal principles when we do community engagement, such as trust. Community engagement is always built on trust. So I think even if we are diverse in some ways, we can still partner and learn from each other when we're doing and engaging the communities, especially in addressing very complex health challenges. Well, we do have a lot of, well, at least for SIHI Philippines, we have a lot of engagements with the communities, because when we say social innovations, it's really coming from the communities. In fact, what we do as researchers and from the SIHI Hub, we just facilitate the process. It's really more on, we act as the catalyst, but we learn a lot with how the community, process all these things and innovate even on their own. So we also learned that very important in community engagement is also the support from, especially from the government. So there are a lot of social innovations that may be small scale, but they are very good and they actually address the health challenges. But because they don't have support, then they remain as, very small social innovations. But with our experience with the CESM strategy, and I think Dr. Oche is already here, we learned this strategy with our partners from our friends from Nigeria and SIHI Nigeria and other hubs in Africa. that this has been very effective. So we applied this to social innovations. We learned that if the mayor or the local chief executive is on board and supports this initiative of the community, it becomes very powerful. I mean, it becomes very effective in not just in addressing the health challenges, but even in the well-being, how people see themselves. They felt good. The local monitors, the volunteers that we engage in this project, they felt good that somehow they are very useful in the community, because most of them were not even able to finish high school or college. But because of the practice sessions, the capacity strengthening sessions, they were engaged because they're the ones who are actually in the community and who are impacted upon by these challenges. So when they are engaged and they're able to understand, not just gather information as monitors, but understand this information, make sense of this information, then they're able to participate, and the local leaders allow them to participate. So I think that's a very big thing if we talk about community engagement and social innovations. The power is shared collectively. So I think Malida can share more
Well,
context of Indonesia.
well, yeah, it is really interesting. I'll be like maybe responding quickly about Dr. Meredith mentioned about like collaboration and like the importance of institution collaboration to kind of like amplify the work, because in Harapan Fian's aspect, it's quite tricky because like the government or like the at least local government seeing that the solution that provided by Harapan Fian is contradict with their values. So we have a kind of like a doing advocacy, like a small discussion, and it seems like they actually not really agree about like the approach that the Harapan Fian does. So this is really like a tricky because like you cannot do kind of like advocacy when you have like a different values with your government. And right now is they are trying to kind of like rather than working on like in an institution level, they kind of like working on like a grassroots level, collaborate with many NGOs and non-profit and also volunteering and trying to like make it just like a small movement. And it's kind of like sad, but I think that's the reality of like when like your efforts not really valued by the government or not really admitted by the government yet. I think that's all from me.
Yeah. That's really great. We can move to question 2. I think plenty of people joining the Menti already. What is a key value that guides the way you engage communities in your local context? Perhaps as you want to share with us, what is the key value that guides the way you engage communities in your local area, in your local context? Anyone perhaps want to share? Also, there's questions in the discussion. Carmen Theo, thank you for the wonderful presentations. I'm Carmen from Malaysia. Sorry, it is not convenient for me to switch on my audio right now. I may have missed this during the first half of the sessions. May I know, for this social innovation work, do you, the researchers, make the first move to engage with the community, or did the community engage with you first? How did you open the way and convince the community to be willing to work and with you, or any specific strategy? How did you begin? Perhaps Dr. Meredith want to share a bit about how to begin.
Yeah, thank you, Carmen, for that. That's an important question. We actually have experience in both ways, but I think when we started in social innovations, it's the hub or even the network who reached out to this community. So we started with crowdsourcing calls. So are there social innovations? How do they look like? And where are they? So in the Philippines, when we had this crowdsourcing call in 2017. This was supported also by our Department of Science and Technology. So we're actually, for every 2 years, we have a national open call, which is named after a social scientist, Helia Castillo. So we call it GCARSI. So it's a Helia Castillo Award for Social Innovations in Research, where we post, it's sort of like a contest because there's an incentive. And social innovators from all over the country would send responses to this. There's a criteria that we in the network that we use that's also adopted in the Philippines to screen which among these are social innovators. I think that's basically how we start engaging, because in our experience also there's a number of social innovators whom they do not consider themselves as innovators, or they don't even know that they are already innovating. But when we let them see the process, how we define social innovations in the network, they're actually, it opens a lot of things for them that, we are actually innovating, and this is something that's can be shared and it's worthwhile. So after that, it can be interchanged. So once we have engaged them already in research, in the long run, we also had social innovations that contacted us. So it's in reverse. So also want to work with us. So in other words, it's both ways. But when we started, it's really the network and the hub that reached out to the communities. And we did this in a national platform because of the support of the government also. And it took a while. And I can understand what Malida is saying, that sometimes, our government officials cannot really understand or are not supportive. And it also took a while for us to convince, our partners in government to support the work of social innovations. So that's why we are really keen, and thanks to the support of TDR and SIDA, we're keen on, documenting this in a scientific rigor, with scientific rigor, in research, and publish this, because these are very strong evidences that our government usually base their decisions on. So once you are able to show that there are outcomes, it changes lives, it's improved lives, there is a societal impact, then it's easier to get support from the government. And I think in engaging the communities, it's really very key. And even convincing the communities, to join and also to continue what they're doing. It's also a bit of a challenge, but once they're engaged, it's a big thing, and it's usually is sustained when they are together with you.
Well,
That's nice, Daisy.
yes, I mean,
Malida.
yes, for saving the time, compared to maybe Philippines, SIHI Indonesia is quite young, and we really trying to kind of open our path bit by bit. And it's really interesting and answering those questions, who is reaching the community first, or a researcher, or as we mentioned that we had the crowdsourcing event. I think that's a great start to kind of identifying or introduce yourself to the in the national or the grassroots level, that you have there's a SIHI Indonesia. We would like to learn from you, learning about any social innovation that occurring in Indonesia. And from those crowdsourcing, we learned that there's plenty of wonderful ideas, innovation that happening, and that in that way we kind of reaching out to kind of let's collaborate further. And that way, that's the first one. We kind of having a good relationship with Harapan Pian, for example, and also the other social innovation. And the second one that will be great, ideally and hopefully in the future, the next step of Indonesia, SIHI Indonesia is kind of collaborating with the government. This is something that we haven't seen the opportunity yet, but that will be great if maybe through Harapan Pian, or maybe other opportunity, we can kind of establish any kind of a good collaboration with them. But right now we're still kind of working on it. I think that's all from the SIHI Indonesia.
Thank you so much, Dr. Meredith and Malida. We'll see the key value from most of our participants. I saw that there's a lot of trust and respect, cultural recognitions, participation, applying collaboration, communication, and commitment, curiosity and respect, formative research on community needs, respect and community involvement, proper community entry, trust building. I see a lot of trust building in your answer. and appreciating the culture, cultural sensitivity, role sharing, effective communication, engagement, and respect. I saw a lot of uh, respect in the community, also in the comments. It's interesting. Perhaps is there any participant want to share about the key value that guides your way to engage your local community? Is there anyone want to share? Okay, maybe still a bit shy to uh, share directly, but please raise your hand if you'd like to use the mic, or if you're too shy, you can just type in and I will read it so other participants can read. But I see that a lot of you had already joined the MOC and it shows, right? Like the key value that guides the way on engaging the. Oh, we have one participant, Obielman Anwargu. Please, the floor is yours.
Obi, in case you're saying something, yeah.
Hi, Meredith. This is Uche.
Oh, Prof.
Teacher
Uche.
Uche, good to hear you.
Yeah,
Go
yeah,
ahead, please. Yeah, we can
congratulations.
hear you.
Yeah, thank you very much and congratulations. This has been, unfortunately, I didn't join early and the capacity was full. And then later, I kept trying with Obi's recommendation. Finally, I'm in. But I heard you talk about ways we can encourage projects and programs, innovators to engage with the communities. And then one of us talked about difficulty in engaging government, even the local government, since they have their own agenda. My suggestion is that when you engage communities, if you're able to engage communities, go design something with them and present with them your whatever innovation you have designed to the local government. That way, the local government stop here. That way, the local government will listen to you, because it's not only the innovators, but the community is now partnering with you. Again, so the spirit of designing something with the community and of course reaching them must be strong, and there are difficulties, there is no doubt, in taking the stride to engage communities. You will encounter some difficulties, colleagues, but once you are able to allow the communities to understand that they should be part of the solution of their problems and engage them from the onset to design those solutions with you, the innovators. Do not bring your ideas to override that of the communities. Allow them and listen to them. So jointly with the community selected people or community leaders, you will design a program or develop a program that in which they feel ownership as well. That program, you must allow the community to play a key role in that program. And that's why crowdsourcing becomes important, because in crowdsourcing, you're now picking or collecting social innovations, no matter how small, already going on in community at the community level and at the district level. And those social innovations help you to strengthen your own and to engage community further into a much stronger innovation. It's not an easy walk-through process, But if you carefully design with community and engage them in a strong manner and make them feel ownership as well, then together with the communities, you will win the confidence of the government.
Okay, thank you so much, Prof. Uche Mazigo. That's a very, very, very interesting take on crowdsourcing and how it is important to understand the value of the community and to listen to your community before going in. Okay, that's Meredith.
Yeah, thank you, Agi. Let me just also react to what Dr. Uche has shared through OB's account here in Zoom. And because she made really very important points on what you shared. And this is actually there are partners. They're the ones that I'm referring to where the CESM strategy on social innovations when we piloted this in the Philippines way back 2022 or 2021. I just want to pick up on what Uche said. Listening to the community is really very important. And it's not an easy thing to do, especially when, we're used to being quote unquote experts because that's our training. We want to bring all these things in the community. But one thing also that we learned is the community is not a blank slate. They are already operating on something that they're doing. So that's why what Uche said earlier is very important. We need to listen and to sense what's already happening in the community. And the second is, it's a very important point, and this takes a lot of challenge in facilitating this, co-designing something with the community. Especially in the Philippines, our health system is devolved. So it's not only the Central Department of Health that's important. You have to speak with the local government units. And this is where co-designing projects with the community becomes important. Because when you pitch this to the mayors or the local health board, then they have the power, they have the resources to support that or not to support that. So I think that's our key learning also in the CESM process, which we learned from the experience of CDT in Nigeria. And thank you, Uche, for sharing that. Always, when we listen to you personally, I always learn many things. So thank you for affirming the work that we're doing in social innovations.
Thank you, Meredith. Thank you. Thank you.
Thank you so much, Prof. Uche and Meredith. Perhaps we can move to the next questions. Question 3. What challenges have you faced in community engagement and IR? Perhaps anyone want to share? And if you're wanting to read a bit of the notes on our session today, you can head to the chat, and Julia has already shared some of the keynotes from our speakers. So let's see, what challenges have you faced in community engagement? Protagonism. Oh, interesting. Well, perhaps Marida, have you ever encountered these challenges, protagonism, or high expectation of reimbursement for participation? Have you tried to overcome this kind of challenge?
Well, I mean, like, I feel I kind of like trying to relate the protagonism with like the one that Dr. Meredith mentioned before, that we feel like we are the expert, right? But actually, it's been like we are the protagonist trying to kind of like assisting them, like helping them. But right, working with them will humbling you down, like literally. Throughout the process of this research, I feel like SIHI Indonesia is only facilitating. We looking for the solution itself is already existing. They already knew the solutions. So There's a one time that we like, oh, let's take doing advocacy and la, 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 la. I feel like it's kind of like a new energy and new idea. But the funny thing is that they have been working on it like many years and it's sticking on like not successful yet. So yeah, working with communities, it feels like sometimes make us like the protagonist, like we can help them and everything. So we feel like the expert. So this is something that we need to kind of like reconsider and trying to kind of like reflect as the community know the answer, the community actually like the expert. I think that's it. Thank you.
Yeah, that's really cool. Oh, there's myths and misconception about the intervention, lack of curiosity, miscommunication, political interference. Anyone want to share? Anyone wants to share? If anyone wants to share, please just raise your hand or type in the chat box. Dr. Meredith, have you ever faced this challenge and how are you overcome these challenges?
Definitely, politics is a challenge in the Philippines, especially during elections. We change leadership every 3 years. And yeah, it affects how we, implement and partner with communities because it becomes, what's the term? It becomes very complicated when there is election. You don't know if the support will last for, a period of time, or is the support only because there's an upcoming election. So these are some of the challenges. Or a politician may, want to partner or engage the communities just for his or her, advantage because of the election. So you don't really know the motive behind, especially if there's an ongoing election context behind the scenes. But I think we also learned from the communities how to deal with changing political environment. And as Malida has shared, there are many things that you can learn from the community which we don't learn in textbooks or even in in the academe. So how you engage, how you are diplomatic with political leaders and their support. It's always the thinking that the money or the resources that they'll be sharing is actually coming from the funds from which is shared for the community. So these are things that you also want to consider. So yes, that's part of the reality of engaging communities. And as a researcher or as somebody who is joining the community, you have to be very sensitive about this, and you have to know who the key persons to talk to, because sometimes political leaders don't want to talk to you, but they want to talk to this particular person. So you need to engage that key person in the community if you want to be heard. So these are just strategies that we also learned in engaging the communities.
That's very interesting. Yep, Obi or Prof. Uche?
Challenges you can face in community engagement is also caused by funders. When you have a program where, assuming you have one where the funders are giving money, to community members, and you come in with a program where you're trying to engage them naturally based on their needs, you find that you run into a problem because what they would feel is, in the other program, we always receive money. Why is your own different? When it comes in like that, you find you cannot move. Yeah, you cannot engage them effectively, which is the reason why people are always, telling, trying to, people in researchers in most communities are trying to, when you have a funder coming, we try to engage them in a way that you don't expose community members to too much funding, showing them that you can give them money. That's one of the challenges you face, as a researcher when you are in the field. Another one is when you don't mobilize them, as Professor Mazigo said, appropriately based on their need, then you cannot get it right. Because it has to be a need they're interested in. And with that, they will all show interest. For example, I know Professor Mazigo a month ago opened up access to healthcare facility in one of the communities where she has a project where she's providing health facility to the community. But there was no access because there was need to build a bridge. Instead of people wading through water to go to access the health facility. So she not only mobilized the community appropriately, because they also knew that they have a need, but also the local government chairman was also mobilized. And with that, they all came together. And that was why we saw what happened some weeks ago over there. They were all overwhelmed and they were all very happy that now they can access the new health facility provided by Professor Amazigo through Danjuba Foundation without having to wade into water to get there. So there is also need to ensure that that is actually what their need is when you are going into community engagement. Thank you.
Thank you so much, Prof. Uche. Perhaps due to restriction of time, let's move on to questions 4.
That's for Lucy.
What stood
The
out to
insights.
you the most in the lessons and case studies from the MOOC? I know that most of you perhaps have already finished or have not yet finished, but already learned and take some classes and case studies from the MOOC in social innovations. Perhaps anyone wants to share their experience, what they learned from MOOC and how you applied it to your own work? If anyone interested, please feel on. I see that some of you has just joined. You can join this session by joining at menti.com and use the code 25724958. The code is in your screen, in the top of your screen, or you can just scan the QR codes on the bottom right of your screen. Is there anyone wants to share what stood out to you the most in the lessons and case studies from the MOOC? Perhaps if we may, maybe Marida, can you share what were your own takeaways from the MOOC, as you're one of the organizers also?
Could you ask the organizer to kind of like provide perspective? Okay, that's interesting, Aki. Well, maybe I'll share my perspective in a way of like as an organizer itself, not like the participant. So I feel like this MOOC is really interesting and exciting. It's like kind of like a next step of like SIHI. Like, so we are trying to kind of like introduce more about like SIHI and social innovation in health, and especially community engagement also, and how it's kind of like embedded to implementation research. So I think in my personal opinion, view, this MOOC is kind of like a really a great step for like a SIHI to kind of like get more acknowledgement from like public health sectors or maybe like beyond. And yeah, that's it. Thank you.
Thank you so much. I heard the I got a DM that questions for is not opening. So if you have a hard time answering the questions on your Menti, you can also answer on the chat room. You can also text in the chat room. Perhaps Meredith, do you have any takeaways from the MOOC itself?
Yeah, I think what I'll be sharing is from the perspective of SIHI Secretariat. So I think this is, while we were talking about this is a good platform for co-learning, because as I understand, the context of the MOOC for community engagement, most of the examples were, the context were in Africa. But we also understand that there are a lot of intersectionalities and common principles in engaging the community in similarly situated communities like Indonesia and the Philippines and in Asia. So, and we also thought that there might be some, unique ways of engaging communities in different contexts. So I think that's the beauty of being in a network and in different contexts and coming together and learning together. So we're actually excited with this, MOOC now coming to Southeast Asia and now being led by Indonesia and Gajah University. So as the SIHI Secretariat, we're really excited on this endeavor. So we really hope that those who have participated, and we also have a lot of colleagues from the network of SIHI Philippines who participated in this MOOC, will really, learn many things from this engagement. And what we're doing now is really real time, exciting exchange of learnings from this MOOC. So thank you for this, and thank you to our partners in SIHI Indonesia for leading this.
Thank you so much, Meredith. Perhaps Obi or Prof. Uche, are you still here? Well, perhaps it's not here. Well, that concludes our session for today. I saw that some of you already responses. We have not yet have a date on the next course. Of course, I have these questions a lot, and we're very glad that you're so interested on the next course. But those were some great reflections from everyone. Thank you so much for participating in today's session of SIHI Talks. Apparently, because it's already Obi, Prof. Uche. Is there perhaps some
I want
final
to,
words? Yeah.
it's Uche. It's Uche. I was trying to speak, and after Meredith, when you called on either Obi or myself here, I want to congratulate the organizers of this meeting in a very special way, because you have placed, in my own humble opinion, you have placed emphasis on the core issues that we need to understand and to disseminate to our colleagues. And those core issues include engaging communities, because if we all in SIHI put emphasis on community engagement, with time, you will see us remodeling in different countries health delivery systems. Because while the health delivery systems have not been successful to the extent that we all want in many of our countries, is because the people themselves, that is the communities, are not part of it. They are not engaged. So congratulations and thank you very much. I really look forward to the same type of meetings again. Thank you to your group, and be assured that one thing I think you may consider is having us a Zoom meeting on purely on community engagement, so that we can discuss thoroughly from many countries, examples, the challenges, and then share those challenges so that the young colleagues coming up who are working in different sites can maybe pick lessons that we have and our experiences in order to improve on community engagement. Thank you very much. Thank you.
Thank you
Over.
very much. Thank you very much, Prof. Uche. Well, that's a very great and heartful appreciations to SIHI Secretariat and TDR Global Team. Well, thank you so much to our speakers also, Dr. Meredith and Malida. We learned so much from both of you, and maybe perhaps you can share your contact details if people want to connect or ask more questions, or perhaps if you wanted to know more about SIHI and TDR. You can follow TDR Global Asia on social media. We posted a lot of informations regarding research and some social innovations also. And you can also visit if you would like to know more about the SIHI, the social innovations, perhaps visit our website or any of our social media pages, as you can see on the screen and on the chat. All previous SIHI Talks episodes are on SIHI's YouTube channel. Once again, thank you for joining us at SIHI Talks this evening. Have a good day and have a good rest, everyone. Bye.
Thank you, Aggie, and thank you, everyone.
Thank you so much, everyone.